Let's Talk Prevention Idaho. This podcast is a production led by the statewide nonprofit Community Coalitions of Idaho, or CCI. Here at CCI, it is our job to support the work of prevention across the state of Idaho through education, training, and providing valuable resources. We help make the work of prevention happen all across Idaho. This podcast will update listeners on what CCI is doing from week to week, as well as provide information for vital professionals in Idaho across the country. All right, so welcome to yet another edition of Let's Talk Prevention here in the state of Idaho with Community Coalitions of Idaho. We are once again joined by my amazing colleague and program coordinator, Chloe Aponte. Say hi, Chloe.
Hello.
And so this episode is going to be super exciting. It's going to be just full of flash and bang, wow. No, it's actually, it's a necessary topic that may not be super, super exciting, but we're all dealing with it. If you are a DFC
grantee.
My gosh, my brain just turned off on me all of a sudden. But if you are one of us that gets this grant, you are going to be impacted by this because we are being taken over. The takeover. It's almost like the storming the beaches at Normandy. The DFC is taking over the oversight of our grants, and I think we've all overcome the first hurdle of our fourth quarter pull down in July. And now we're looking at what is this world of the DFC taking over control of our grant. What does that mean? What is that going to look like? And this is another topic that was pulled from the CADCA mid-year training that we all had access to. If you did attend CADCA mid-year and you didn't watch this, go to this training, I do want to remind you it is available for the next 30 days. So 30 days from the end of CADCA, I believe we were able to go back and watch videos. I'm sad to say I have not done that yet, but as I'm talking about it now, it's reminding me there's a few that I didn't get a chance to see that I really want to go check out. So if something that Chloe and I talk about is interesting to you and you'd like more on it, you can, for 30 days towards the end of, so I think right up until the last week of August, you should be able to go and check that out yourself. And then too, we're going to give you some useful nuggets here on the podcast that you can use to get ready for this. I know that we just did our August report, and we actually had a little correction we had to go back and make, and it's a different look, it's a different feel, but we can get through it together. And that's one of the nice things about the atmosphere, especially looking at comments like on the CADCA forum and stuff, is everyone is very willing to help each other. We're blessed, Chloe and I are blessed to have some amazing board members that have a lot of experience that I feel like are going to be able to help make sure that we transition very easily, but not everybody has the resources at their fingertips that we do. So if you are an Idaho coalition and you are a DFC recipient and you are worried about this, unsure anyway, please feel free to reach out to us. We this is our job to support you, and we will take any information that we have, any insight that we have, and we will most surely pass it on and help you find some level of surety and reassurance as we process through the end of this year and through the CDC oversight. So, and hopefully 2021 will be a lot less crazy. This was a crazy year to have all this stuff happen on top of everything else we're already dealing with. I mean, so many of us, our programming just got blown up by COVID, and then we had to deal with all this other stuff. I feel like I've been doing more reports and stuff than I've been actually doing programming, but neither here nor there. So Chloe, what did we learn from this amazing, insightful training that was done? Because it wasn't really, it was great information. It's just not the exciting topic that everyone was drawn to. I think most of us were drawn to it out of sheer curiosity and fear, right?
Right, yeah. So this one's just talking about the DFC support program management transition. And the presenters were ONDCP and CDC staff. And they're talking about why they transitioned, kind of the timeline of switching from SAMHSA to CDC, and then some training resources that are going to be available to all DFC grant recipients. So like you said, it's not like super juicy stuff, but I feel like it's really important to know as we're all going to be transitioning to a new system, and to new resources and to new platforms. So it was a really helpful training, and I believe it was Monday afternoon. If anyone has access to that mid-year portal, wants to go back and watch the whole thing, we'll just be giving kind of snapshots of what they were talking about and highlighting those key points.
So one of the things that I've seen is that there is going to be a series of trainings for coalitions to sit in on to be prepared for operating in this new oversight. One of them I think is tomorrow, correct?
Correct, yeah. So they're calling them, the portal is called Grant Solutions. So when that transition is complete with CDC, then we're going to be using the Grant Solutions portal and no longer use ERA Commons is what we use now with SAMHSA. So those DFC program transition sessions, we do have one tomorrow, but there are also other sessions available that will be coming up. And then October 1st is when they want to finalize that transition period and have CDC officially start kind of providing that grant oversight. But I do have an email. It's dfc@cdc.gov, and that's where we can direct any coalitions, not just in Idaho, but DFC recipients. They can go to that email and request the dates for those transition trainings. And those are going to be more in-depth and focus on that Grant Solutions platform.
So what does this do in regard, are we aware of, is SAMHSA being, like, are they still going to be a part of this prevention process, or what is their role now going to be with?
So what had happened is that ONDCP just felt like it was the right time to help. It was the right time to look for another organization to help propel the DFC grant and program and the work of community coalitions. And they found that it would be mutually beneficial to have a relationship with CDC. So SAMHSA will no longer be managing the DFC grant at all. And I don't know how much involvement they'll have with CADCA or any of those things. I imagine they would continue to be a partner. But there won't be any grant oversight from SAMHSA after October 1st.
So it's going to have a new staff, new
structure.
Yeah.
Yeah, so based on what they said, and I can kind of shed some light on that, they had said that, let me pull it up.
And let me rephrase everybody. My ignorance on this is I knew she was in that conference, so I didn't go.
Hey, that's good, right? We didn't need to double up necessarily. So the CDC is made up of a number of different centers. The DFC grant is located in the Division of Overdose Prevention branch of the CDC. And they have 3 prevention branches, and one of them is overdose prevention, and that's where the DFC grant and the team and the staff is going to be housed. And let's see here. So we will receive from the Office of Grant Services within the CDC. We will receive a grants management officer, a grants management specialist, and a project officer that will all be assigned to help with our work on the ground as community coalitions. So a little bit different than what SAMHSA, their structure and everything, but we're going to be receiving that same support from CDC staff as we do with SAMHSA staff. And like I said, we're going to be using grant solutions, and we'll no longer use the ERA Commons platform in the future, just because that's the platform that CDC uses. And some of the things we'll be able to do with grant solutions is submit those non-competing continuation applications, submit federal financial reports, as well as amendments for prior approval requests, and then view our grant notes. So similar to ERA Commons, but those are the specific kind of subcategories that will be on the Grant Solutions platform. And they will also, CDC has said that they are going to be sending out monthly updates through DFC Me at the end of each month that either address grant solutions where applicable, or just other updates that we would need to know as DFC grantees.
So this training that we have tomorrow, what is this first introduction to this new world? What is it? Is it labeled something? Is it give us the core settings, or just telling us to be there?
You know, it didn't really specify, but based on what they said in this CADCA mid-year training, is they want these trainings that they're providing to the community coalitions to be ones that help us understand grant solutions and that platform, and help us navigate it and kind of work through that transition from ERA Commons to grant solutions. But I also think it's to become more familiar with CDC and the process maybe that they have to go through as now managing the grant. And CDC has hired, internally and externally, has hired leadership and staff to be specifically dedicated to the DFC. And they're underway with the financial transfer process from SAMHSA to CDC. I mean, they've done the technical reviews for the non-competing continuation application. So CDC is really trying to work well with SAMHSA to make it as easy for us as grantees. And I think these trainings and these like webinar trainings are for the purpose of easing that process as well, that they don't want to make it difficult for us, even though it'll be a change.
Yeah, I find it ironic that this is happening in this year of COVID, because the CDC has been the main spotlight for the entirety of the year when it comes to reporting numbers for COVID and stuff, and has really, in my opinion, has shown a spotlight on all the other things that the CDC has information on or oversight on. I mean, one of the things that everyone was throwing, it was popular to throw around CDC recommendations and stuff, and so I started using CDC's recommendations on marijuana use to educate our coalitions on different ways that they can use what's prevalent in the media now. Like, everyone's talking CDC, it's something that pops up on your social. So using that as a form to continue our work of getting the message out of the harms that substances can do to your body. So I find it just extremely ironic that in this crazy COVID-19 2020 world that this transition is happening to, I can't imagine the scrambling that's going on over there, because they are not dealing with the normal everyday environment at the CDC. Did anything come up about that, about the struggles that they're dealing with?
They didn't give, that was interesting. They didn't give like a lot of insight into having the DFC grant transition on top of everything that's going on. But one of the presenters did mention that this is something that's been in place since last year's National Leadership Forum. So the timing, like you said, is kind of funny that it's lining up this way, just because there's been such a spotlight on CDC. But I think one important thing to mention, and something that the presenters mentioned, ONDCP staff as well as CDC staff, is they wanted to talk about what CDC's role is, not just as it pertains to the DFC grant, but in general. And so I was wondering if that's okay if I share kind of their 6 main things that they have identified as their role. So those are detecting and responding to new and emerging health threats, which we've seen, tackling the biggest health problems causing death and disability for Americans, putting science and advanced technology into action to prevent disease, promoting healthy and safe behaviors, communities, and environment, developing leaders and training the public health workers, including disease detectives, and taking the health pulse of our nation. So interesting that those are the 6 main roles that CDC has set for themselves, and that we can see the overlap for COVID-19, but also for the DFC grant and all the work that we do as substance abuse prevention professionals, and where that overlap really is, and that we've seen increased rates of substance abuse because of COVID or correlated with COVID for many different reasons, but there is that correlation. And so how CDC will specifically address that is going to be interesting to see.
Another thing so this is the thing that tripped me up when I came here to Idaho and started working in prevention, is the acronyms. Some of the acronyms were like, I'm like, what does that mean? And it was hard to ask because sometimes you're like, I should probably know what that means, but I don't. So do you know what ONDCP stands for?
So ONDCP is the Office of National Drug Control Policy.
Check you out.
Yeah.
And then we all know CDC is Centers for Disease Control.
Right. Yeah, DFC, Drug-Free Communities Grant, right? Yeah, it's interesting to see. I was thinking about that as we were talking about this, is all the different agencies that are involved in substance abuse prevention and why they're involved and why it fits. And I think CDC works on they address a lot of issues, health issues, behavioral issues, lots of things that happen in our nation. And I think it's interesting that now it's going to be housed under that division of overdose prevention within the CDC. So that'll be an interesting transition to kind of see their perspective and their education kind of color how we move forward in our prevention work.
It's also going to be it's going to be interesting to see how they move the DFC grant forward, because I know a lot of people are they're working on certifying for the next 5 years. So from the verbiage, it sounds like the goal is to grow the program. So that's always a good thing if you're a DFC grant recipient, because that means the money's not going away, and you are recertifying for the next 5 years. That should be, in my opinion, that should give you some confidence, because that means that you're more likely to get it. And then those people who are looking at being new grant recipients, hopefully if they want to grow the program, then getting these new recipients in and qualified should be a main goal of theirs. So it speaks well, because I know you, Chloe, you and I, we were kind of doing our virtual roundabout with the state of Idaho, talking to our coalitions. One of the needs that came up the most was funding. Funding just to run their day-to-day operations, and looking at ways to take that off of the table. Has everybody said, if there was a way to take the the needs of paying my staff off the table or growing my staff so that you don't have 2 people doing the work of 10, it would make this so much easier. So
Yeah.
hopefully we'll see more funding put out to deal with prevention, because there's so little funding, especially when it comes to, I think a lot of states have lost the battle to recreational and medical marijuana legalization, just because the sheer amount of money that the legalization side has access to, and the amount of money that the side combating the legalization effort is pennies on the dollar. So
Yeah.
hopefully,
And that's why I hope that any of our listeners, whether you're in Idaho or not, please share with us resources for finding additional funding, but also if you're a coalition or the beginnings of a coalition that is a need of yours, reach out to us as well. We want to be a support there. We want to be able to connect you with maybe funding opportunities or partners that are able to also connect you as well. So always, to any of our listeners, reach out to us whether you have information about funding or need information about funding. We want to be able to connect not only coalitions in Idaho, but like we've mentioned in earlier podcasts and probably in this one, that we have those connections not only in Idaho but across the nation, and that we'd be able to make those connections hopefully for and on behalf of coalitions here in Idaho.
Yeah, there's been I think there's been at least 2 or 3 trainings this year that we have been either a part of or sponsored that have turned into multi-state, if not nationwide efforts, where you have people from all over the country coming together to learn on various topics, whether it's drug trends, law enforcement, social media. There's a really big need, and if you are that is a really good segue, Chloe, to if you are an Idaho coalition, there are opportunities that CCI offers to you to take some of what you might normally spend off the table. We do offer, for example, in this COVID situation, we offer Zoom. You have access to the Zoom platform, newspaper subscriptions. We have in-house graphics creation, so you can talk with our graphics creation team one-on-one, have your graphics created the way to your liking, and then the team sends us the bill. So you pay nothing for it. They have all of the resources and everything that you need, and we pay for it, you don't. So it's just little ways that we have come up with to take some of those expenses off the table, because we all know that we have learned how to do 101 things with pipe cleaners. So we're very resourceful with a few funds that we do get, but to help you be able to maybe get a few of those dollars back into your pocket so that you could, whether it's plan another event for your youth, or as simple as giving a plaque to someone who's dedicated many years to your organization and has never really gotten any tangible, thank you thing, whatever that is, we would love to be able to put those dollars back into your pocket. So as we wrap this up, I would really love, if you are an Idaho coalition, I would love for you to reach out to us. If you're not a member of CCI, Chloe and I would love to have a conversation of how that can benefit your coalition and what we can do to help you navigate through the world of prevention here in Idaho. And if you are one of our nationwide listeners, feel free to reach out to us. We'd love to plug you with other people that do similar things that CCI does. I know this podcast was born out of I think it's the New York Resource Prevention Coalition. They handle oversight and support for all of the coalitions in the 5 boroughs of New York City, and it kind of puts into perspective, if the city of New York needs a version of CCI and a support and oversight nonprofit, that's a big city. That's a lot of people. So, but they've been doing a podcast before us. I sat through their training at CADCA, and I was like, wait a minute, this would be a great way to get information out to our membership as well as to continue to inform people working in the field of prevention. So we have lots of resources that we can share with you and that we can use to make this whole prevention thing easier for you. And if you do have any questions about the CDC switchover, as we learn, we would love to share the information with you. So, and what was that email again? One more time, Chloe,
Sure.
so that they have any questions that they need from people who actually know like everything that's happening.
Yeah, it's dfc@cdc.gov, and they're the resource to ask about the dates for those training sessions.
So if you want to learn more about those training sessions, we're going to date this podcast, but we're going to be the next training is August 20th. This will probably go published after August 20th. But if you do want to find out about those trainings, go ahead and email the CDC at that email address, and they will get you that information. So anything else, Chloe?
Nope, that's it. Thank you.
All right, guys, well, have fun out there in the world of prevention. And like I said, if you need any help from us, give us a message.